conversation around healthcare is changing. It's no longer confined to the sterile walls of a hospital or a doctor's office. Today, that conversation is happening in our homes, through devices we use every day. Artificial intelligence, or AI, voice technology is at the heart of this transformation. Think about simple health assistants that can answer basic medical questions. Or consider automated systems that call patients to remind them about their upcoming appointments. These are not futuristic dreams. They are real applications being used right now. This technology is quietly becoming the new front door to healthcare services. It offers a simple, accessible way for people to engage with their health. The benefits of integrating AI voice into our current health systems are already becoming clear. For medical staff, these tools are a massive help. They can handle repetitive administrative tasks like scheduling appointments, processing patient check-ins. This frees up valuable time for doctors, nurses, receptionists. They can then focus on what truly matters, providing direct care to patients who need them the most. Imagine a clinic where the waiting room process is streamlined by a friendly AI voice, guiding patients and reducing wait times. This efficiency is not just about saving money. It's about improving the quality of care and reducing burnout among our healthcare heroes. For patients, the experience is also enhanced. An AI-powered system can offer round-the-clock support. Looking ahead, AI voice technology is poised to become an essential part of our daily health and wellness routines. Imagine waking up and having your smart speaker provide a personalized health briefing for the day. It might say, "Good morning. The pollen count is high today, so remember to take your allergy medication. You have a 30-minute walk scheduled for this afternoon to meet your fitness goal." This level of integration will make proactive health management feel effortless. It will not be a separate task we have to remember. It will be woven into the fabric of our everyday lives, just like checking the weather or reading the news. This future is closer than we think. Wearable devices like smartwatches already track our heart rate, sleep patterns, and activity levels. The next logical step is to connect this data to an intelligent AI voice system. This system could analyze your data in real time and provide immediate, actionable feedback. For example, if your watch detects an unusually high heart rate during a period of rest, the AI voice could calmly suggest that you practice a few minutes of deep breathing exercises. It could then guide you through the exercise step by step, offering a helping hand right when you need it most, turning data into direct support. One of the most profound promises of AI voice technology is its power to make health information truly accessible to everyone. Public health communication often struggles to reach diverse populations. Complex medical jargon literacy challenges, language differences create significant barriers. Many people cannot understand printed health pamphlets or navigate confusing healthcare websites. AI voice can overcome these obstacles by communicating vital health information in a simple conversational way. It can speak to people in their native language using words they can easily understand, ensuring that no one is left behind due to a language or literacy gap. Think about an elderly person who has difficulty reading small print on a prescription bottle. An AI-enabled device could read the instructions aloud, including the dosage time of day and any important warnings. Consider a recent immigrant who is trying to understand a public health alert about a local virus outbreak. An AI voice assistant could translate the alert into their native tongue instantly, providing them with the same critical information that their neighbors receive. This technology acts as a universal translator and a patient advocate, ensuring that every person has the knowledge they need to protect their health and the health of their family. This accessibility extends to individuals with visual impairments or physical disabilities that make typing or using a screen difficult. While the potential benefits of AI voice in public health are immense, we must proceed with caution. The same technology that can deliver life-saving advice can also be used to spread dangerous misinformation. Imagine a fake AI voice convincingly mimicking a trusted public health official that broadcasts false information about a vaccine. It could tell people the vaccine is harmful or ineffective, causing widespread panic and vaccine hesitancy. These deepfake voices can be incredibly realistic and hard to distinguish from the real thing. This threat is not hypothetical. False narratives already spread fast on social media. AI voice adds a more persuasive layer to that problem. A calm, authoritative voice sounds more credible than a simple text post. Scammers could build fake medical hotlines. They could trick vulnerable people into sharing personal information or paying for bogus treatments. A sick, scared person is more likely to trust a reassuring voice promising a quick cure. Protecting the public will require new digital literacy and robust verification systems. Beyond misinformation, there are serious concerns about data privacy. AI voice assistants collect vast amounts of sensitive information. Private conversations, our health concerns, our daily routines. Where is all this data stored? Who has access to it? Could it be sold to third parties? Insurance companies? Pharmaceutical firms? An insurer might use this data to raise premiums if voice patterns suggest stress or a developing health condition. As we embrace AI voice technology, we must confront a critical question. Will it help close existing health gaps, or will it make them worse? The potential for good is clear. AI can deliver healthcare information to underserved communities. However, there is a significant risk that it could also widen the digital divide. These technologies rely on access to smartphones, smart speakers, reliable internet service. Many people in low-income areas, rural areas, lack this basic infrastructure. If public health services become increasingly dependent on AI voice, those without access could be left even further behind, cut off from essential information and care. Furthermore, the AI models themselves can perpetuate and even amplify existing biases. AI systems learn from the data they are trained on. If that data is primarily collected from one demographic group, for example, white affluent males, the AI may not perform as accurately for women, people of color, individuals with different accents or speech patterns. An AI voice assistant might struggle to understand the speech of someone with a strong regional accent, leading to frustration and miscommunication. A diagnostic tool might fail to recognize vocal biomarkers for a disease in a demographic group that was underrepresented in its training data. This can have serious consequences. To harness the power of AI voice for public health safely and responsibly, we need more than just good intentions. We need a clear and robust framework of ethical governance. This framework must be built on the principle of transparency, accountability, and safety. First, companies developing AI voice tools for health must be transparent about how their algorithms work. We need to know what data they are using. We need to know how they are making decisions, and we need to know what their limitations are. This is not about revealing trade secrets. It is about ensuring that doctors and patients can trust the technology they are using. Opaque black box systems have no place in healthcare. When an AI system makes a mistake, for example, by providing incorrect medical advice that leads to harm, who is responsible? Is it the software developer? Is it the hospital that deployed the system? Or is it the doctor who relied on its guidance? We need to establish clear lines of responsibility so there is a pathway for recourse when things go wrong. Without accountability, there is little incentive for developers to prioritize safety and accuracy. Regulations should require rigorous testing, post-deployment monitoring, and a clear process for reporting and addressing errors. This governance must also include the creation of global standards and a system for certification. Just as we have regulatory bodies that approve new drugs and medical devices, we need a similar process for AI health applications. An independent body should vet these technologies to ensure they are safe, effective, and unbiased before they can be used in a public health context. Thinking about ethics now is not about slowing down progress. It is about steering it in the right direction. Ethical considerations are not a barrier to innovation. Instead, they are the guardrails that ensure our technological advancements lead to a future that's better, safer, more equitable for everyone. By addressing the challenges of bias, privacy, misinformation head-on, we build a solid foundation of trust. Without that trust, even the most brilliant technology will fail to achieve its potential. People will not use tools they do not believe are safe, fair, and working in their best interest. Ethics, therefore, is the very cornerstone of sustainable innovation in public health. As individuals and as a society, we all have a role to play in this conversation. We must become more discerning consumers of digital information. We need to learn how to spot the difference between credible health advice from a certified AI source and a convincing but fake voice spreading misinformation. Public awareness campaigns can teach people to ask critical questions. Who created this tool? Is it certified by a trusted health authority? Is my data being protected? Encouraging this kind of critical thinking is our first line of defense against the misuse of AI technology, empowering everyone to be a guardian of their own digital health. It is a societal conversation, and every voice matters. Your engagement can help shape policies that protect our communities and ensure technology serves humanity.